Hello, and welcome to today's episode of In Medicare News. Today is September 17th, 2018. Today's article, it's a couple of days old. It comes from npr.org. It was on September 13th, 2018. The article is titled, New Medicare Advantage Tool to Control Drug Prices Could Narrow Choices. Before I explain this one, I just want to kind of remind people and warn you ahead of what you're going to hear from this. You guys know, if you've watched more than one video from my channel already, or you've been to my website, you know that I'm not an educational service. I do run an insurance agency. This website is connected to, this channel is connected to a website, and the website does give you a way where you can contact somebody to purchase insurance, although you cannot purchase it online. It does give all the disclaimers about talking to someone and making sure that you know that we are not just an educational institution. That being said, I do try to make these videos educational. It serves the dual purpose of I want to get my name out there, I want to get my brand out there, but this was genuinely started because at the time, there seems to be some now, but at the time there was really no way that a person could find general information about Medicare online without putting in a whole bunch of personal and private information. I didn't want that. I wanted people to become educated. Then after you got educated, if you had more questions, you were going to hopefully talk to someone, not do it yourself. And if one of the my purpose of doing this is, hopefully maybe I could convince you that I am one of the people worthy of your time to talk to see if you can get your questions answered and get a appropriate type of coverage possible. So even though I am connected to a business, there's many easier ways for me to actually spend the time to actually advertise the business than to put up this site. But this site does serve a purpose that I felt that the market needed at the time. I still feel it needs it, although depending on when you watch this, if you watch this far in the future, it does seem to be getting better. But I do put this stuff out there with the hope that you're going to get educated, maybe get some of your questions answered, maybe be a little bit more of an informed consumer than you might have been if you just, put your information in, signed up, and got something and had really no idea what you were getting. So that being said, I say all that because of what I'm just about to say right now. Some of the things that I'm going to say are almost always going to be connected with the words, this is why you need to talk to an insurance broker, an insurance agent. This is why you should be calling someone like me or calling me. Because this has a direct effect on, this is a very complicated topic, and it's going to have a direct effect on what happens to you, how the plan is going to work, and these aren't generally questions that have come up in the past, and this is something that if you were already on a Medicare plan, a Medicare Advantage plan, and been dealing with this is a fundamental change that an insurance agent or an insurance broker really should be talking to you about, or with you about. So here we go. Back to the article. The warning of the commercial is done. The article title again is from npr.org, and it's from September 13th, 2018. Sorry, it's a few days in the past. I've been busy. New Medicare Advantage tool to control drug prices could narrow choices. Now, here's what's going on. The first sentence, starting next year, Medicare Advantage plans will be able to add restrictions on expensive injectable drugs administered by doctors to treat cancer, rheumatoid arthritis, macular degeneration, and other serious diseases. I'm going to translate that sentence for you. it says that beginning next year, there's going to be utilization restrictions on Medicare Part B, as in boy, approved drugs on Medicare Advantage plans. Excuse me, not a guarantee they will be. It's a possibility that there might be. The government is allowing Medicare Advantage plans to put utilization restrictions on drugs. Now, utilization restrictions, there's primarily three for the purposes of easy to understand insurance. Here are the three. There is a quantity limit. Quantity limit is just means that only a certain number of pills can be dispensed to you over a certain number of days without a doctor overriding it. 1 pill per day, 2 pills per day. That is a quantity limit. This can be overridden by a doctor if the doctor contacts the company, says this is medically necessary, and the insurance company talks with them and everything. They can get that all taken care of. But that is one and the most common of utilization restrictions. The second utilization restriction is called prior authorization. Prior authorization means that the drug is covered, but before the plan will allow the drug to be paid for by the plan, subject to your copay, your coinsurance, your deductible, all that, the doctor's office will need to contact the insurance company, and the doctor and the insurance company will have to make sure that, yes, this meets medically necessary guidelines. It is important that the patient have this to maintain their quality of life. So that's a prior authorization. That one's actually fairly common. A doctor's office, basically, if someone like me, see, I told you you'd hear that from me pretty often. If someone like me, when you get placed in a prescription drug plan, I'll get to that in a second too, tells you, yes, this drug is covered, but before it's covered, your doctor is going to have to call it in to the insurance company to lift the flag or lift the restriction, then that is a prior authorization requirement. So if you hear that it's a prior authorization that must be called in by the doctor to the insurance company. It's actually fairly routine, fairly standard. Doctors' offices know how to deal with that very easily at this point. The third and final common utilization restriction that shows up is called step therapy. Step therapy means that before a particular drug is covered by a plan, the insurance company will want to see that you either have tried or can safely try an alternative prescription before that specific drug is used. I mentioned, and again, this is something that shows up in the Medicare Part D program, and it's something that if you've already tried this drug in the past, all the doctor's office needs to do is call the drug company, call the prescription drug provider and say, they've tried this, they cannot use this anymore, we've got to use this drug. Or if they say, look, man, this drug can't, well, a doctor will never say, look, man, but if the doctor's office says, look, this person needs to have drug A. I know you're saying you want them to try drug B first, but they're going to die if they don't take drug A. The insurance company usually is just going to go ahead and say, okay, we're going to do this. So these are this is the step therapy requirement. Now, all of this has been around since the inception of Medicare Part D, as in drug. Medicare Part D. As a matter of fact, the only time you have ever seen any kind of utilization restriction is on Medicare Part D. Why? Because Medicare Part B has never actually had any utilization restrictions. Why is this important? Well, it's because now they can be. Now, this article actually is just saying only the step therapy restriction is going to be listed. I don't know if there's going to be a prior authorization or a quantity limit restriction as well. But I do want you to note that Medicare Part B drugs, they exist. They're rare. Most people do not have a Medicare Part B drug. Medicare Part B drug, they pretty much described it here, and they've neglected to use the word some, but I will use the word some drugs to treat cancer, rheumatoid arthritis, macular degeneration, and other serious diseases. Medicare goes on to say a Medicare Part B, B as in boy, approved drug includes anti-cancer medications, some immunosuppressant medications, and medications that must be administered by a doctor or registered nurse. So that's generally the description. If it falls into there, it's generally Medicare Part B, or at least it can be Medicare Part B. You can also add to that medications that go in to a Medicare Part B authorized device, which would be medications that would go in very frequently to a nebulizer or other breathing assistance machine, not just a forced air machine, but machine that takes medication that goes in it, or insulin that goes into a diabetic pump. Very frequently is covered as a Medicare Part B drug. If it doesn't go into the pump, it's almost always going to be Medicare Part D. If it does go into a pump, you got a chance of it being covered by Medicare Part B. If it's covered by B, B as in boy, you have not had any restrictions on those drugs. That means that if the doctor approves it and it falls into Medicare Part B's guidelines, it is covered by Medicare Part B. Period. That's it. And if you had it with Medicare and it was covered by the supplement, or you had it under a Medicare Advantage plan, as long as the drug was given, prescribed, and administered through Medicare Part B's requirements, it was covered. If you just had Medicare, you paid your applicable 20%. If you had a Medicare Advantage plan, you paid whatever your applicable coinsurance is. Period. You were done with it. The only time you had to worry about other stuff is if you came in under Medicare, had a drug under Medicare Part D. Then you had to worry about prior authorization, step therapy, and quantity limit based on the drugs that it would be. It's no big deal. Now, if you have a Medicare Advantage plan, then you are going to possibly, beginning in 2019, have a utilization requirement. That means that if you have an MAPD or an MA plan, you may have to suddenly start satisfying certain requirements before that drug is covered. That is a big change for some people. Very frequently, these drugs are given by a doctor on a regular basis. If it is an injection you get, and this injection needs to be covered by a doctor, or needs to be administered by a doctor weekly or monthly, how much of an extra step is this going to be? Is this going to be something that you're going to have to lift once in the year? Or are you going to have to get it lifted every time you administer it? Now, if you have a Medicare supplement or work insurance where Medicare Part B is picking up at the top, this does not apply to you. If you have a Medicare supplement, as long as Medicare is going to approve the drug, the supplement is going to take care of the rest. This is no longer an issue. This is for my Medicare Advantage people. If you have a Medicare Advantage plan, and if you are looking into a Medicare Advantage plan, this could be a big deal for you. You need to sit down with somebody. We are less than a month away from the annual election period. That's the time where you consider whether or not you're going to be keeping your Medicare Advantage plan or not. and you need to make a decision, and this needs to factor in your decision. If you're our client, this is going to be something that we automatically factor in. We need to talk and see. Do you take any Part B as in boy medications? If you do take a Part B as in boy medication, we now need to find out, is this going to have a restriction on it that you didn't have last year? And if so, can you deal with the restriction? Are you okay dealing with the restriction? Keep in mind, that is everything else being equal. Are your drugs going to be covered? Are your doctors going to be covered? Are the copays affordable? We have to factor that in anyway, talking to you about your current plan for next year. Now, in addition to all that, we've got to start talking about whether or not your Medicare Part B drug is going to be covered, and if not, if the answer is maybe, if the answer is maybe, what kind of restriction, what kind of roadblock is going to be placed in front of you next year that wasn't placed in front of you this year, and is that something that you can live with? So if everything else is equal, the plan we're looking at is just going to be, just fine for you next year. We now have to ask the additional question, are you going to be okay with what they're putting in front of you as a restriction to getting that drug, if there is a restriction at all? If the answer is going to be no, then we got to go back to square one and find you a new Medicare Advantage plan that's going to work with you. So that's a lot of work, and that's something we got to do. That's on us to to work with you to make sure that it's going to be appropriate coverage for you. But that is something that has to be looked at. If you are doing this by yourself, consider talking to a professional this year about that, just because that's going to be an additional concern for you. If you have a drug that is a Medicare Part B drug and it's been covered by your Medicare Advantage plan, consider taking a look and seeing if there's going to be an additional restriction. Again, Medicare supplement people with people that have a Medicare supplement, this isn't an issue for you at all. You don't have to worry. This video is totally useless to you. If you've got work coverage, take a look at your summary of benefits. Ask your employer's HR department if this is something you have to worry about. That is not something work coverage. They've got a different set of rules and regulations that they follow. Basically, the answer for you guys is check on your own work coverage and see. Or check with your HR department. But, if you've got a Medicare Advantage plan, it's individually purchased, talk to somebody to find out about this. Now, I wanted to just go one step further, so I looked a little bit deeper into this with from the NPR thing. NPR article, and I went to CMS.gov, and I looked at what they said about it, their official wording for it. They call this a fact sheet, and this is actually official, even though it's a fact sheet. This is from August 7th, 2018. I'm just going to kind of read some of this to you. Today, the Centers for Medicare and Medicaid Services introduced much-needed competition and negotiation into the market for physician-administered and other Part B medications that will result in better deals and lower drug costs for patients. As part of the agency's ongoing activities to deliver on President Trump's promises outlined in the American Patients First Blueprint, and you can click the link to read that blueprint, CMS will provide Medicare Advantage plans the option of applying step therapy for physician-administered and other Part B drugs in a way that lowers costs and improves the quality of care for Medicare beneficiaries. Medicare Advantage plans will have the choice of implementing step therapy to manage Part B drugs beginning January 1, 2019 as part of broader care coordination activities that include patient rewards and incentives. Currently, there are more than 20 million beneficiaries enrolled in Medicare Advantage plans, or one-third of the Medicare beneficiary population. It goes on beyond that, but I mean, that's the bulk of it. So it looks like it is just step therapy. Their purpose for doing this is to hopefully reduce costs, and they might be reducing costs for people. That all is great. I'm all for reducing your costs. Hell, my job is to reduce your costs as much as possible. That goes along with getting you access to healthcare. If you can't afford your share of the costs, you don't have access to healthcare. So, I mean, that's my job. That being said, by reducing costs, they're introducing an additional step, an additional restriction that you have to go through. So if you're on one of these Medicare Advantage plans, if your mother is on one of these Medicare Advantage plans, they have to go through this new step beginning next year. Factor this into your consideration as you look at either renewing or changing Medicare Advantage plans, or if you are health capable, changing to a Medicare supplement. Factor this in. This is one of the things I look at with all of my clients in a Medicare Advantage plan, and if they're looking to go into a Medicare Advantage plan, or if they want to get out of a Medicare Advantage plan. This is something that needs to be factored in. You must find out if you want to deal with the step therapy requirement going into next year. So, that is the news article. I will end this with just a reminder. When you need to talk to somebody, be it during the annual election period or in the middle of the year if you're capable of doing it, talk to an insurance professional. My preference is an insurance broker, but talk to an agent if you want. Talk to somebody that deals in the Medicare-related insurance field. And, as always, if you live in Ohio, West Virginia, or Kentucky, give us a call. We're happy to work with you.